Hi, I'm Dr. Laura Grashow, a licensed psychologist with drgrashow.com. Please remember that advice from this video is not intended to replace actual psychotherapy. Okay, so now let's talk about treating children with ADHD who have violence issues. I'm gonna, for purposes of this video, divide the ADHD population into two groups. What's typically associated with ADHD is irritability, impatience, and being short-tempered. But then there's another, maybe smaller segment of the population of children with ADHD who also have episodes of what I would call explosive rage, where they really lose control and it lasts a long time. It's hard for them to calm down and they can become really violent, threaten to hurt themselves, threaten to hurt others, destroy property. When talking about this segment of the ADHD population, it's also important to look into their diagnosis and make sure that these rage episodes aren't better accounted for by, say, another diagnosis such as bipolar disorder or psychotic disorder, or maybe even substance abuse. And this kind of thing really should be evaluated by either a neurologist or a pediatric psychologist. Tegretol is a medication that I know of that has been used in treating these episodic, explosive rage outbursts. But let's go back to the other segment of the ADHD population, which is really more typical of that population and involves treating irritability, impatience, and short temper. Again, as with many of the approaches I take, helping parents and teachers is extremely important. We want to give them good techniques for managing this difficult behavior, setting limits, and being an effective disciplinarian. And then the other component is working with the child directly and teaching them anger management skills. They've got to learn to identify their anger, and then they've got to learn some anger control techniques. In addition to that, you want to help children unlearn learned anger responses. So get them out of the habit of responding to frustration with anger.